Minister, in this past summer, your government advanced $19 billion to the provinces under the Safe Restart Agreement. These expenditures were important and necessary to help the provinces provide vital services, and especially now, this is important because we are in the second wave of the pandemic. In the speech from the throne, your government promised to include national standards for long-term care in your agreements with the provinces. However, I have reviewed the Safe Start agreements that have been published. They are published. And with respect to long-term care facilities, I see that increases in staffing levels were mentioned in some of those agreements, but actual staffing standards were not addressed in those agreements. Experts have made it clear that improving the standards for staffing, including better training and employment equity, better pay, and higher ratios of staff to patients will improve the standards of care. So my question to you is as follows. Where are the national standards for long-term care that were referenced in the speech from the throne? Are the investments in increased staffing in some of those agreements your government's response, or is there more to come from the government with respect to these standards? And if there is more to come, can you tell us what those staffing standards might include? Now, obviously, this is very relevant today as we see with the second wave, seniors' residences across the country experiencing outbreaks with mortality rising and great hardship for many seniors. So that is my question. Thank you.
Thank you very much for that question. I think all of us are tremendously concerned by what is happening in long-term care facilities across the country. We have seen that this is really a weak spot truly across the country. And I really think it's a national tragedy and a national shame that so many of our elders are dying of the coronavirus. And we're seeing with the second wave that the long-term care facilities continue to be a point of tremendous vulnerability. When it came to the Safe Restart Agreement, our objective, working very collaboratively with the provinces, was to give them the additional resources that we felt they needed to get ready for the second wave. We took a very collaborative approach and set out some clear categories where we knew support would be needed. Long-term care was one, and some areas that we believed there should be a focus on. But we're also very mindful that with the Safe Restart Agreement, we were providing federal funding for areas of provincial jurisdiction. When it comes to national standards for long-term care, I think there's a broad national agreement today that we need to have that in Canada. But I think none of us should minimize the amount of work it's going to take to get those standards, to have standards that work for the country, to have standards that have real buy-in from all levels of government. That is going to be a real process of discussion and negotiation between the provinces and territories and the federal government. So we need to do it. We will do it. I believe we need to do it properly. But I will, in conclusion, Senator, say that I think while that is some slightly longer-term work, getting real standards in place that raise long-term care in the country to a new level, there is an urgent need for action and improvement today. The federal government is there providing people from the Red Cross right now across the country to support people living in long-term care facilities. And we're working actively with the provinces to discuss whether there are other types of support they need to protect our elders.